Welcome back to Periods 101. In this lesson, we are going to be reviewing some of the key hormones that are responsible for controlling the menstrual cycle. Knowing what each of these hormones are responsible for is going to help you to understand each phase of the menstrual cycle. And as a reminder, there are 4 phases of the menstrual cycle: menstruation, the follicular phase, ovulation, and the luteal phase. So I want to focus on 4 hormones that are key players in the menstrual cycle. Because if you can understand these 4 hormones and how they interact with each other, you'll have a good idea about what's happening throughout the menstrual cycle. Starting off with estrogen. Estrogen is a growth hormone. That's because it stimulates the growth and the thickening of the lining of the uterus. I like to think of estrogen as the Beyonce of the hormones. She's feisty, she's confident, she's got lots of energy, she's responsible for the growth and development of the breast tissue and the reproductive system. She is Sasha Fierce. There are actually 3 different types of estrogen. Estradiol, or E2, is the main reproductive estrogen. It's produced by the ovaries and it regulates the menstrual cycle. It also maintains bone and heart health. Estradiol is highest during the reproductive years and it tends to drop in menopause, which is why osteoporosis and heart disease are more common in menopause. Estrone, or E1, is considered like a backup type of estrogen. It is a weaker form of estrogen that can be converted into estradiol if needed. Estrone is present throughout life, but it's more dominant during menopause, when estradiol declines. Estriol, or E3, is the pregnancy estrogen. It's produced by the placenta during pregnancy. It supports the baby's growth and development, but it also prepares the body for childbirth. If estrogen levels are too high, then symptoms like mood swings, heavy periods, painful periods, and PMS may occur. When estrogen levels are too low, this can cause a loss of libido, dry skin, and irregular cycles. Progesterone is known as the pregnancy hormone. It's a very calming hormone. I like to think of this hormone as the Sade of the menstrual cycle. It's very chilled. Progesterone is produced by a temporary gland known as the corpus luteum. More about that later on this week. Progesterone helps you to relax. It also helps you to sleep deeply, and it prevents the uterus from contracting. So it keeps the uterus stable, it maintains the lining of the uterus, and it prevents the uterus from shedding the lining or contracting, which could disrupt early pregnancy. Progesterone, however, can also cause breast tenderness, bloating, and fatigue in the luteal phase. And low levels of progesterone are also associated with PMS, irregular cycles, and anxiety. In fact, this is one of the often overlooked causes of anxiety, is if women are actually not ovulating, because it's during ovulation when we produce progesterone. This is the reason why many women who go through menopause begin to feel feelings of anxiety, because during menopause you're no longer ovulating, which means you're no longer producing progesterone, the calming hormone. Follicle stimulating hormone, or FSH, is the egg recruiter. It's produced by the pituitary gland in the brain, and it stimulates immature eggs, also known as follicles, in the ovaries to begin to mature. Follicle stimulating hormone is essential for a regular cycle and for ovulation. Luteinizing hormone is the ovulation trigger, and it's also produced in the pituitary gland. It triggers the release of the mature egg from the ovaries. This hormone is low throughout most of the menstrual cycle until it surges just before ovulation. If LH does not surge, then ovulation cannot take place. It's also the hormone that is tested when you're doing an ovulation test kit. So the menstrual cycle is a coordinated feedback loop between the brain, the ovaries, and the uterus. In future lessons, we will explore each phase of the menstrual cycle, but just as an overview, the way this whole system works is almost like a relay race. So FSH, or follicle stimulating hormone, stimulates the follicles, or the immature eggs in the ovaries, to start to grow and develop. As the follicles begin to grow and mature, they release estrogen. Estrogen rises and begins to thicken up the lining of the uterus, while the immature follicles continue to grow and mature. Then LH surges, triggering ovulation, the release of a mature egg from the ovary. The empty follicle left behind like a crater on the surface of the ovary now becomes the corpus luteum that starts to produce progesterone. Progesterone keeps the lining of the uterus up and prevents the uterus from contracting, just in case a fertilized egg lands in the uterus. And if pregnancy doesn't occur, then the drop in estrogen, together with the corpus luteum running out of producing progesterone, cause both estrogen and progesterone levels to tank. And with estrogen and progesterone down in the dumps, there's nothing to keep the lining of the uterus in place, and it begins to disintegrate and fall away in the period. There are many other hormones at play throughout the menstrual cycle. Understanding these four and how they interact with each other should give you a clearer understanding about what exactly is happening throughout the menstrual cycle. I hope this makes sense so far. If you have any questions about this section, leave them for me in the comments. And in our next lesson, we'll take a closer look at the first phase of the menstrual cycle, menstruation.